Hi, my name is Jerry. You can call me Aria, and the drug I'm going to introduce to you today is Naxitamab, which is a commonly used intravenous antibody drug for treatment of neuroblastoma. My video is divided into 4 parts. Here is the context. The first part gives us a general idea of what the drug does. This is a brief introduction to the drug, which is a target agent for treatment of refractory high-risk neuroblastoma in combination with granulocyte macrophage colony stimulation factor for remissions, minor remissions, or stable disease. It is often used in children and adult patients 1 year and older. The following is a list of drug knowledge, so that you can understand the knowledge about the drug more clearly. We can understand its target of actions, injection method, and chemical knowledge of effective substance. Alright, I believe you already have a certain understanding of this drug. Let's take a closer look at how it works in our bodies. Then we look at the mechanism of actions, which is how this drug works against cancer. Naxitamab is a humanized monoclonal antibody detecting ganglioside, and GD2 is an alveolar ganglioside that can be highly expressed in a variety of neuroectodermal tumors and sarcomas, which can induce antibody-mediated cytotoxic response and achieve the complement system in the immune system to achieve the effect of killing tumors. In short, GD2 interact with directly antibodies like GPS, induce complement-dependent cytotoxicity and antibody-dependent cell-mediated cytotoxicity as ADCC. ADCC was enhanced when Naxitamab was administered in combination with granulocyte macrophage colony stimulating factor, so as to achieve the effect of killing tumors. As patients, we're curious and worry about how this drug gets out of our body. It breaks down into smaller peptide substance and is emulated through cellular uptake and subsequent lysosomal degradations and catabolism, a process that happens in the kidneys. It's well known that the side effects of cancer drugs are very large. A full understanding of its side effects will help us to use it better and alleviate its harm to us. The following are his common adverse effects. They are increased heart rate, vomiting, decreased white and red blood cell, and platelet count, and decreased blood level of the potassium, sodium, and phosphate, general or local body swimming, increased liver function blood test, and adverse physiologic symptoms such as anxiety and irritability. The doctors and the patients need to know medication intoxication in advance. Naxitamab can cause serious infusion reactions and neurotoxicity, which requires careful monitoring during treatment. All patients should be pre-treated with intravenous corticosteroid, as well as antihistamines, H2 receptor antagonists, and so on, to reduce the risk and severity of the influence-related reactions. And pain management should be implemented before and during treatment. Patients should receive 12 days of neuropathic prevention, starting 4 days before the infusions, and should several opiates 48 to 16 minutes before the infusion, followed by intravenous opiates or ketamine as needed. Naxitamab is currently a common used clinical drug for treatment of high-risk neuroblastoma worldwide. Its application is based on 2 clinical trials, and in November 2020, Naxitamab was approved for medical use in United States. It was approved in December 2020 by Cytotoxicity Pharmaceuticals and YMBS Therapeutics Inc. Reached an inclusive identified license agreement to be listed in China and put into use. As a global medical problem of common concern, we hope that each of us can have a better understanding of anti-cancer drugs and use them right. I hope my video can help you to know this new drug. Thank you for your listening.